Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years. Hello, welcome to today's presentation, Managing Diabetes with Exercise, presented by Lina Huang, Clinical Manager of the Diabetes Program at Washington Hospital Healthcare System. Lina has been dedicated to her field of diabetes education for over 20 years. Lina is deeply passionate about education and enhancing diabetes management, both within the hospital and throughout the community. We are delighted to have her here with us today. Please welcome Lina Huang.
Thank you for joining me today. My name is Lina. I am the clinical manager for the diabetes program here at Washington Hospital. And today I'll be talking about diabetes and physical activity. Before I start, I'd like to acknowledge our wonderful dietitian. Her name is Ying-Lu Peng. She helped me put together the slide that we'll be using for our presentation today. So, in terms of diabetes management, there is something what we call diabetes management triad, which include nutrition, medication, and physical activity. All are equally important in glucose management. However, for today's presentation, we'll be focusing on physical activity. Physical activity and exercise are mentioned quite a bit in a lot of conversation that we do in our daily conversation. Actually, both of this terminology have different meaning. Physical activity encompasses any body movement that increase our use of energy. On the other hand, exercise is a subset of that physical activity. Exercise is a physical activity that is planned, structured, and performed with the goal of improving our health and our fitness. Because of the nature of our presentation today, I'll be using these two terms interchangeably. Okay, so in terms of keeping active, what are the health benefits of keeping active? It takes a lot of work for us to keep active, correct, right? So what are the health benefits? There are many scientific evidence that show the benefit of consistent physical activity in diabetes, in glucose management. We know that by being physically active, we actually help our body to be more sensitive to insulin. So physical activity is actually the best insulin sensitizer. By moving our muscle, we allow our muscle to pull sugar from the blood and use that sugar as energy. So the end result is by pulling the sugar out of the blood, we will lower our blood sugar. At the same time, we have more energy. In the long term, consistent physical activity also enhances our insulin sensitivity and reduce our A1C. Many studies have shown that consistent physical activity actually lower A1C level regardless of the changes in weight. So even though you do not necessarily have a weight loss from the physical activity, but the A1C will still be lower. It also decreases insulin resistance and also decrease post-meal blood sugar level across ages and across body sizes. So there are many benefits of physical activities in glucose management. This list is a very extensive list of other benefits of by being physically active outside glucose management. This list is from CDC. Again, the list is quite extensive. It shows that by being physically active, it will help you lower your risk for having heart disease or having stroke, lower your risk for having a high blood pressure, or developing diabetes, improving your cholesterol level. It can also lower your risk for cancer, as well as lowering your risk for dementia, including Alzheimer's disease. It can improve anxiety, reduce your risk for depression, improve your sleep, and obviously it will also have a positive result or outcome on your weight in terms of reducing weight gain. And if you are an older adult, it can also improve physical function as well as lower the risk for falls. So there are a lot of these health benefits. The question that we have now is how often and how long and how intense should we do physical activities in order to reap the health benefit that we just talked about. The good news is there is a good guideline out there. CDC had put up a nice guideline for physical activities in all age group. The one that I do have here is the guideline for adult. So the magic number here is 150 minutes per week. So the recommendation from CDC is to do a moderate intensity of aerobic exercise for at least 150 minutes per week, and a muscle strengthening exercise for 2 days a week. The 150 minutes of aerobic exercise does not have to be done all in one day. The recommendation is to spread that aerobic exercise throughout the week with no more than 2 days of no exercise at all. So if you are busy with work, what you can do is, you spread this 150 minutes into, for example, 30 minutes of walk every single day while you're at work. So that 30 minutes of walk times 5 days of work week will total into 150 minutes. So it's something that really easy to do. If you are prefer a vigorous exercise such as running, you can do that as well. The number of minutes that you need to complete in a week, if you do vigorous exercise, would be 75 minutes per week, so half of the moderate intensity. You can definitely do more than 150 minutes of moderate intensity exercise, or more than 75 minutes of vigorous exercise, vigorous intensity exercise per week. You'll get the added benefit, but the magic number here is again 150 minutes for moderate and 75 minutes of vigorous at least per week. There are different type of exercise here. The CDC mentioned aerobic and muscle strengthening exercise. I just want to go through the difference with you. Aerobic activity or aerobic exercise is just basically some sort of a cardio exercise, exercise that will increase your heart rate. You may be breathing harder than normal because of the exercise. Example of that will include walking, running, jogging. Walking, running, and swimming. Muscle strengthening exercise is the type of exercise that basically cause your muscle to work against a applied force. You can use your weight as a force that you need to push against. And basic example of this muscle strengthening exercise will include something like resistance training using exercise band, weightlifting exercise, or even yoga posture. Because in some of yoga posture, you will have to use your weight as a force that you need to push against. So that can count as a muscle strengthening exercise. Balance activities is also recommended by CDC for older adult to improve stability and also to decrease the risk of falling. Example of balance activities include something like walking backward or standing on one leg. If you cannot do stand on one leg by your own, you can definitely hold on to a table or hold on to a chair or wall and kind of like try to stand on one leg if you can do that safely. So for older adult, CDC recommend to add these balance activities in addition to aerobic and muscle strengthening activities per week. There are also other type of exercise. You might have heard about weight-bearing exercise, which is a type of exercise that promote bone health. Example of that include running, walking, jumping, and weightlifting. As you can see, a lot of those examples are similar to the type of exercise that we categorize as aerobic or muscle strengthening exercise. And there's also exercise type called flexibility exercise. Is basically an exercise that help you improve or maintain your full range of motion. So stretching exercise would be a good one to do to improve your flexibility. So the easiest way to gauge physical activity intensity is using something what we call a relative intensity measure. It's basically measured based on each person fitness level, and it's based on each person perception level of how much effort that they need to put in to do the exercise. The scale is 0 to 10, 0 being resting and 10 being maximal effort to complete the exercise. So for relative light intensity, it means the person feels that they are putting less than 50% or less than 5 level of effort out of the 10, out of the scale of 0 to 10. For moderate intensity, the level of effort is 5 to 6 out of 10 maximal effort, and then for vigorous intensity is 7 to 8 level of effort. A good rule of thumb to know whether or not you are doing a moderate intensity is what we do. It's something that what we call talk tests. So basically, when you're performing a moderate intensity exercise, you may be breathing harder, but you can still have a conversation easily. So basically, you can talk, it's just you cannot sing. Vigorous intensity exercise, it's a lot harder. And when you are performing vigorous intensity exercise, basically you cannot say more than a few words without pausing for a breath. That's basically a good rule of thumb, knowing where your intensity level, whether it's moderate or vigorous intensity. And obviously, because this is based on each person perception, one type of activity may have, may be categorized at different level of intensity. So for example, walking slowly for a young person may be considered as light intensity from that young person perspective, but walking slowly from an older person perspective may be considered as a moderate intensity, because it maybe take a lot more effort for the older person to do the walking. So we talk about moderate and vigorous intensity exercises as recommended by CDC. How about light intensity exercises? Are those any benefit to all the health benefit that we talked about before? And actually the answer is yes. Some is better than none. There are many studies that shows the benefit of light intensity exercises. One study shows that light intensity exercises are actually just as effective as moderate to high intensity exercises in lowering A1C. There was also another study that shows that light intensity exercise improve all-cause mortality, improve waist circumference, improve triglyceride level. Triglyceride is a type of cholesterol. And CDC also show data that transitioning from no activity at all to just 60 minutes of exercise per week has been associated with many health benefits. So the message here is really be as physically active as your ability and condition allow. Move more and sit less throughout the day are really helpful with improving your health. And there are many different ways to perform light activities at home or even at work. So for example, if you are at home and the only thing you can do are light activities, you can, for example, like if you watch TV, you could march in place when you are watching TV. You can stretch your arm when you're sitting, and doing any house chores such as cleaning, mopping, vacuuming, or even washing your car are really helpful in keeping active at home. Gardening is also another activity that's quite useful to keep your body moving and be healthy. If you are on the move and you take a bus, for example, then you can get off the bus one stop earlier. That way you can get to your destination by walking. Carrying grocery as weight, or biking to your destination, or walking again if you do like walking. That's another way of keeping active and doing a light intensity type of activities. At work, a lot of us tend to sit and watch computer, sitting and work on a computer for a long period of time. One way to keep active at work and doing this light intensity type of activities is that, you can stand when you're on the phone, or you can do some sort of like lifting your arm up and down as a chair exercise, or even take a break between work, right? You just try to stand up for at least 1 minute for every 1 hour of sitting. So these are some of the examples that we can do to complete the light intensity activity. And if you can do the moderate and the vigorous intensity level of exercises as recommended, there are added benefit. The aerobic exercise will enhance insulin action, and that will actually enhance the insulin activities in your body, sometimes even longer than 24 hours. It increases fat metabolism. And any of the muscle strengthening exercise, such as the resistance exercise, will increase the muscle mass and prevent muscle loss with aging. And increasing muscle mass is actually very useful because it also improves our glucose utilization. And if you do exercise, and if you've been doing exercise or want to start exercising, and if you do have diabetes, the best time to exercise with diabetes is 1 to 3 hours after eating, because that's the time that our blood sugar level is likely to be higher. So by exercising 1 to 3 hours after eating, we actually, allow our muscle again to use this blood sugar for energy and lower our blood sugar. If you are using insulin, it is important to test your blood sugar before exercise. And if the level is lower than 100, you do want to have a small snack that will help you avoid blood sugar level. And if you do have less than 100, what you want to do is test again in 15 minutes to see that whether or not your blood sugar has been stabilized. And this is for your information, if you are taking insulin, the risk of developing low blood sugar is highest between 6 to 12 hours after exercising. If you haven't done any exercise at all and you plan to do, you plan to start exercising, this is a general guideline in terms of preparing for exercise safely. Number one is, you may want to talk to your doctor first, get clearance in case you are taking medication or have medical condition that may influence the way you need to do exercise, whether the intensity or the type of exercise that you can do. The other thing is to wear proper attire, proper clothing, especially shoes and socks. You want to make sure that they're not restrictive and they improve your circulation. And that's what we talked about previously. We want to prevent low blood sugar, especially if you are taking insulin, by checking your blood sugar before and after. It's always better to exercise with a partner. It's safer. You have somebody, a buddy, that can help you in case you get into trouble. And it's also for motivation, to have somebody that, you can exercise with. The other thing is wear medical identification. In case you get into trouble again, then somebody can have your information, the medication that you're taking, as well as medical condition that you do have. And lastly, stay hydrated. In terms of the exercise itself, usually each exercise session should include a warm-up session of 5 to 10 minutes, and then the active exercise itself, and then the cool down of another 5 or 10 minutes. The warm-up session is basically a 5 or 10 minutes of low intensity aerobic exercise, and this is need to be done basically to prevent muscle injury and also to make your workout to be more effective. There are different things that you can do. There's example that we have there. So, you could march in place in your spot for, like, for example, 3 minutes, or you could do a knee lift for 30 seconds. You could do a shoulder roll for 2 sets of 10 repetitions. So there's different things that you can do to help you warm up. And then as far as cool down, the purpose of cool down is to bring your blood pressure and heart rate down gradually, and to prevent muscle stiffness and soreness. So things that you can do, you can slow walk for about 5 to 10 minutes, or you do a lot of stretching. So there's a lot of example on the screen there for stretching. You can do your head tilt, you can do an arm reach, side arm reach to cool down. And to start exercise can be difficult, right? Because you do have to, because you are starting something new that you need to fit into your schedule. So some of the recommendation to start fitting in exercises into your routine is to find something that you like. If you like dancing, you like walking, then probably that's the one that you want to start. You turn exercise into something that you enjoy doing, and you do want to start small. And then gradually increasing the duration and the intensity over the weeks. So example here, you can do is you can start by walking the dog or walking in the park. Just start small, find a partner, because having a partner can be more motivated for you, especially if you are somebody that counting on you to do the exercise with them. The other thing is to pick a goal, pick a specific and realistic goal. So for example, if you like walking, maybe you can do a 10 minutes of walk this week, and maybe in the next 2 weeks, then you increase that to 15 minutes. Pick something small that also attainable, something that you can achieve within the time period that you set for yourself. The other thing is, and the last thing here is like really schedule it in. You want to schedule it into your routine, and the more you do this consistently, the quicker it is that it will become a habit for you to do the exercises that you need to do. This is a sample walking program. This is an 8 weeks program. The example here, on week 1, for example, you can do a slow pace walking for 10 minutes for 4 days. So then you complete a 40 minutes walk in a week, and then you're doing the same thing on week 2. And by week 3, you increase that a little bit to 15 minutes. And then slowly, every week, you add more until you achieve 150 minutes of walk per week. So this is one example that you can do. So obviously, there are many different things that you can do in terms of, completing light intensity activities or moderate or vigorous type of intensity. I just want to summarize things that we have discussed. We talk about that physical activity has many health benefits, especially in diabetes management. It results in a better glucose management and lower A1C. The recommended activities for adults include 150 minutes of moderate aerobic activities per week, and that need to be spread over the week, and plus a muscle strengthening exercise of twice a week. In terms of knowing how to gauge whether or not we're doing a moderate intensity exercise, we can do a talk test. Talk test meaning, we can still doing the exercise, we can carry on the conversation, we can talk, we cannot sing. And if you cannot do any of the moderate or the vigorous type of intensity level of exercise, some is better than none. Light intensity activities has also been shown to have many health benefits as well. Just remember that you can make your home be your gym. So with that, I finish our discussion today. If there's any question.
Thank you, Lina. We do have a few questions. I have limited range of motion and physical disabilities. What exercises can you recommend?
So stretching would be helpful to improve flexibility. There's different type of stretching. Depending on your mobility, it could be just upper body or lower body type of stretching that can help with the your range of motion.
Okay, thank you. The next question is, how does lack of exercise affect diabetes?
Wow, many things. There are many disadvantages of not doing physical activity at all, like being sedentary. So number one, obviously you can gain weight, and by gaining weight, it will actually decrease our insulin sensitivity. You may end up having insulin resistance, requiring more medication to control the blood sugar. It also associated with Depending on your type of other diseases as well, it can potentially increase your cholesterol level if you are already predisposed to cholesterol, a high cholesterol. So that will increase your risk for heart disease, right? And it may potentially also increase your high blood pressure, will increase your risk for heart disease. There are, and obviously by not managing your glucose, by not being active, potentially glucose management will become harder, right? Because remember, the triad of glucose management is nutrition, medication, and physical activity. By not doing the physical activities, it will make your glucose management harder, and not having the glucose being kept under therapeutic level, you may end up having a lot of the acute complication as well as the long-term complication of high sugar. And long-term complication of high sugar include many things, right? Include renal disease, your kidney maybe become damaged, your eyes, and as well as your nerve. So you may end up having a lot of those damages on different organ in your body.
Okay, thank you. This does conclude our program. Thank you, Lina, for this insightful presentation. And thank you, viewers, for tuning in. The entire broadcast of today's presentation will be available on our Facebook page and YouTube.